And thank you at home for staying with us for the next hour. On July 27th, 2.5 weeks ago, Democratic Congressman Frank Cradaville was hanged in effigy outside his congressional office in Maryland. The staged lynching, the really well-tied noose and all, was gleefully staged by an anti-health reform protester. Later that week, on August 1st, Democratic Congressman Lloyd Doggett of Texas held a town hall event at a grocery store in Austin to talk about health care reform. An anti-health reform protester there greeted him with a mock marble tombstone engraved with the congressman's name on it. 2 days after that, on August 3rd, Democratic Congressman Brad Miller of North Carolina reported to the Capitol Hill police that he had received death threats over his support for health care reform. One anti-health reform protester called his D.C. office and told a staffer, quote, "Miller could lose his life over this." The very next day, on August 4th, the idea of a Democratic congressman being killed because he supported health care reform became a punchline for Republican Congressman Todd Akin of Missouri.
Different people from Washington, D.C. have come back to their districts and had town hall meetings, and they almost got lynched. And so the people are so
That same day, Democratic Senator Chris Dodd, who had just announced days earlier that he has prostate cancer, had this screamed at him by an anti-health reform protester outside one of his town hall events.
Barack Obama clearly said all you should do is take a painkiller. How come we don't just give Chris Dodd painkillers? Like a handful of them at a time. We can wash it down with Ted Kennedy's whiskey.
2 days later, on August 6th, the Fox News anchor Glenn Beck on national television turned the threat of a political assassination into the acting out of a political assassination when he and one of his staffers wearing a Nancy Pelosi mask role-played what it would be like for Glenn Beck to poison the Speaker of the House of Representatives.
I just wanted to, you gonna drink your wine? Are you blind? Do those eyes not work? There you go. I want you to drink it now. Drink it. Drink it. Drink it. I really just wanted to thank you for having me over here to wine country. You know, to be invited, I thought I had to be a major Democratic donor, a longtime friend of yours, which I'm not. By the way, I put poison in your... No.
The day after that, on August 7th, there were more death threats. Congressman Brian Baird of Washington reports that his office received this fax with an image of President Obama with a communist hammer and sickle symbol painted on his forehead and the message, "Death to all Marxists, foreign and domestic," written underneath. The day after that, on August 8th, anti-health reform protesters started turning up to Democratic town hall events while armed. In Arizona, a gun is dropped during a meet and greet with Democratic Congressman Gabrielle Giffords. The same day, a man with a concealed gun is escorted out of an event held by Democratic Congressman Steve Cohen of Tennessee. Yesterday, the staff of Democratic Congressman David Scott arrived at their Georgia office to find a 4-foot swastika painted across the sign for their office. Congressman Scott says he was also sent an Obama death threat fax similar to the one sent to Brian Baird's office, only this one also addresses Congressman Scott himself, and it uses the N-word. Also yesterday, Democratic Congressman Dennis Moore of Kansas reports that he's received 2 death threats over the last 10 days. One he describes as a phone call into one of his congressional offices. The other is a threat he says he does not feel comfortable discussing with the media. Yesterday also brought us a healthcare town hall event featuring President Obama himself in Portsmouth, New Hampshire. Among the anti-health reform protesters outside the event was a man named William Kostrick, who stood outside the presidential event with a loaded handgun strapped to his leg. He was holding a sign at the time that read, quote, it is time to water the tree of liberty. A reference to Thomas Jefferson's famous words, "The tree of liberty must be refreshed from time to time with the blood of patriots and tyrants." As we noted last night, just for context, when Timothy McVeigh was arrested after the Oklahoma City bombing in 1995, he was wearing a T-shirt that had on the front of it a picture of assassinated President Abraham Lincoln, along with the words "Sic Semper Tyrannis." Those were the words shouted by Lincoln's assassin right after he shot him. On the back of McVeigh's T-shirt was the same slogan that William Kostrick paired with his loaded gun at the Obama event yesterday. You can see both the sign and what Tim McVeigh picked out special to be wearing when he got his mugshot taken for having blown up a federal building and killed 168 Americans. At the same event for President Obama in Portsmouth, New Hampshire yesterday, a 62-year-old man named Richard Terry Young was arrested after sneaking past security officials and into Portsmouth High School just a few hours before President Obama was due to arrive. Mr. Young was allegedly carrying a knife when security officers found him, and when they got a warrant and searched his pickup truck, they found a .38 caliber Kel-Tec semi-automatic pistol hidden inside a bag in his truck with a round in the chamber. Today, at a town hall event for Democratic Senator Ben Cardin of Maryland, the Hill newspaper reports that one anti-health reform protester stood outside the town hall, quote, with a small handwritten sign, cardboard sign, that read, quote, "Death to Obama." The forces against healthcare reform are the same forces that have always been against healthcare reform. The corporate interests that profit from the way things are now, and the politicians who support those corporate interests. Healthcare is a multi-trillion-dollar industry, and special interests want to protect what they've got. That is common knowledge. That is politics as usual. What is not politics as usual is that opponents of healthcare reform have chosen to fight at this time with force and with threats of force. Not just fringe talk show hosts, but members of Congress telling their constituents that Barack Obama is like Hitler. Members of the United States Senate telling their constituents that they are right to be afraid, that healthcare reform really is a plot to kill the elderly. Corporate-funded conservative PR operations promoting those lines of attack and then telling their activists to go put the fear of God into members of Congress. Are we now operating in a political environment which is not just politics as usual, which is not just a rowdy debate? Has enough kerosene been poured on the flames that the possibility of violence, even assassination, is being posited as a real political tactic in the United States? It's not a rhetorical question. It's not even a question about rhetoric, because there are people in this country, people in the healthcare field, in fact, who have faced the actual threat of assassination as a political tactic. 2.5 months ago, Kansas abortion provider Dr. George Tiller was assassinated, and the man who's charged in that case purportedly believed that assassinations were justified because of his own beliefs about abortion. That belief in justified political violence was cultivated by the extreme anti-abortion movement that Scott Roeder is known to have had extensive contact with before Dr. Tiller's death. As the anti-health reform protesters flirt with the same exaltation of violence, the same excuses and purported justifications of violence that echo in the extreme anti-abortion movement in this country, it is worth remembering that the possibility of American politics turning to violence and terrorism at the fringe, it's not all theoretical. Joining us now is Dr. Warren Hearn. He's director of the Boulder Abortion Clinic in Colorado. He is one of the few remaining doctors in this country who perform late abortions, and he has lived for decades now under the threat of assassination. Dr. Hearn, thanks very much for joining us tonight.
Thank you for inviting me, Rachel.
Doctors who perform abortions have faced the real threat of violence and assassination for many, many years now. Do you see any parallels between the sort of rhetoric and threat that we're seeing now against healthcare reform and the character of the threats that you have faced for years now?
Yes, I do. I think that this is a very frightening development. I'm alarmed by the kind of treatment that these mobs are giving to members of Congress and the encouragement they're getting from important political leaders like Sarah Palin and others. We began seeing aggressive rhetoric and very violent rhetoric coming from the anti-abortion people even in the 60s and the early 70s that had to do with even things like birth control, family planning. I received some of these threats in 1970-71 when I was working with a family planning program in Washington, D.C. In 1973, when I helped start the first nonprofit abortion clinic in Colorado, I started getting obscene death threats in the middle of the night. The anti-abortion violence began in the 70s, and in the early picked up a lot of steam. There was a time when people could debate this subject, which is obviously very controversial, and people have different opinions, and the debates were usually rather civil. But the anti-abortion people began to be more aggressive, more harsh in their rhetoric, and more aggressive in their tactics, and began using violence against property, against doctors' offices and clinics. And it was obviously a trend in the wrong direction. And in the 80s, we saw the increasing threats on people, among women who were seeking services, and upon doctors.